Hello and welcome to My Counselor Live. You guys, we're so excited to be with you today for another episode, another counselor who we get to talk to and glean some wisdom from. So today we're joined by September Trent, and September's actually been on the show before. We've gotten to chat before, and she just brings so much wisdom. I just love how eloquently she speaks into different things. So September, welcome to My Counselor Live, and I would love for you to just take a moment, introduce yourself to the people watching who have maybe never met you before.
Yeah, thank you so much. I'm so glad to be back. I am September Trent, and I work in the Springfield, Missouri office. And I've worked for the company for about 8 years. And I work with individuals who struggle with anxiety, depression, self-harm, eating disorders, and a variety of other things as well. And I really enjoy the work that I get to do here with helping others just achieve the goals that they want and get to integrate Christianity within that.
Love that. Yeah. So today we get to chat through one of your articles that you've written. And this article is an article that is kind of heavy. It's a really heavy article, and I'm excited to talk through it with you and hear kind of your thoughts behind it. So this article is called Trauma and Self-Harm, Why They Coincide. And so we're going to just talk through that a little bit. And I want to start with kind of a basic question. Who did you write this article to, and what inspired you to write it?
Yeah. Thank you so much for that question, because I had a specific client type that I was writing to and some inspiration for this article. And specifically, I have quite a few clients who struggle with trauma and self-harm. And so I wrote it for them and their families. And I just have noticed how much shame and guilt there is around both of these topics. And so my inspiration was just to give them a voice and help them feel understood and help um, their families, their friends understand this. And then ultimately to reduce the stigma, because there's so much stigma specifically around self-harm. And so I want people to feel like they can have a voice, they can seek help without all of this shame and guilt getting in the way, and we can work on it through therapy.
Yeah, and I love that you also touch on, family and friends, it also being written for them, because I think that that can be a really hard situation to be in when you don't understand what that person is experiencing. So I love that you wrote it for them as well.
Yeah.
Let's start by just giving me a basic overview of really just self-harm. What is it? Why can it occur?
Yeah, definitely. Yeah, so broad definition of self-harm is just purposely harming yourself through the one that you hear talked about a lot is cutting, but we also consider like burning yourself, hitting yourself, maybe picking your skin, punching yourself, banging your head as all ways that you could self-harm. And for some people, they may question some of those, and that may be hard to hear that maybe picking skin and other types of things are self-harm, but there's also kind of ranges to it, and that some behaviors with certain disorders can be repetitive, like picking of hair, things like that. But then there's also the behaviors that can be maybe more severe, like with the cutting or the burning and those types of things. So that's just kind of a broad definition of where we put the self-harm. But why does it happen? Why do people engage in it? And there can be a lot of reasons for that. So a lot of times I see people who are experiencing so much emotion, difficult emotions, they don't know what to do with it. And so self-harm is a way to get that emotion out, to have a physical manifestation of that emotion. Also, there are people that I work with that they're so numb, they cut themselves just to feel. Um, Also, and we'll talk about this a little bit later, but they want to communicate their pain to people. They want people to know that they're struggling, and maybe they don't have words for that. It can also be a distraction. Maybe there's so much going on in life that this is a way to distract themselves.
Yeah, yeah. Could you, and you talked a little bit about this, that, it can look like a variety of things, not just, necessarily cutting, which is probably the one that we think of typically.
Yeah, yeah.
But could you be doing self-harm, experiencing that without even realizing it, almost like a nervous tick, a nervous tendency that you do.
Sure. Sure. I mean, it is possible. Most people, if it's becoming um, an area where they're really struggling with it, they'll know that they're doing it. If someone's like picking their skin, it may not get to the self-harm level because they feel somewhat in control, or that it doesn't happen all the time, or maybe their purpose isn't like to hurt themselves. It's just kind of repetitive. There is a possibility, but most people know I'm hurting myself for a reason.
Right. Yeah. So let's kind of go into kind of the connection between trauma and self-harm. I thought this was so interesting. You touch on it in your article that the Greek word for trauma is wound. And I just think that that's really interesting. So how common is it for people who have experienced trauma, who are experiencing trauma, to also be experiencing self-harm?
Yeah. Yeah, with talking about wound, I use that quote by Diane Langberg because I love that word picture of trauma being a wound. Because people who have experienced trauma, especially like sexual trauma or assault, or just a traumatic experience, there's so much shame with it, and they turn in on themselves. There's something wrong with me. I did something wrong. And it helps to look at it as a wound, just like a physical wound, that if we got hurt and we had to go to the hospital, before they could bandage, before they could stitch up the wound, you have to clean it out. And there's gonna be some pain there. And you know that with a physical wound. And then they clean it and they maybe stitch it up, bandage it. That's same with some trauma work. You're gonna experience some pain as you work through it, but there is going to be healing. Healing is possible. And so, with your question about self harm, trauma and self harm don't always go together. But we do see it a lot with people who have experienced maybe sexual abuse or sexual trauma, just because of how they view themselves, how they view their body after that. So we don't always see it, but it is more common with trauma. So that's something when someone has experienced a traumatic experience, we ask about that. We make that something that they know they can talk about. And if they've experienced that, we need to talk about it.
Yeah, and you mentioned self-harm sometimes being used almost as a coping mechanism for those who have experienced trauma. And I find that's just so interesting, as someone who hasn't experienced this, as someone who hasn't walked through that kind of trauma and that kind of response to trauma, that harming yourself could come out like almost like you think it's going to heal you. How does
Yeah,
hurting yourself feel like coping? So can you kind of expand on just the coping mechanism part of that?
yeah, definitely. Yeah, first off, I think it's important to say, yeah, it becomes a coping mechanism. It's not a healthy one. They may say it's helping them, but ultimately, as a professional, in the long run, it's not. But seeing what their purpose is for it is helpful. And with trauma, it overwhelms us and what we know about ourselves in the world. And what that person used to use as effective coping skills a lot of times don't work anymore. And so they use this self harm as a very tangible way to manage emotions, or be able to stay in the moment, kind of ground themselves when they feel like they might be dissociating into the trauma or with difficult emotions. Also, it can be something that they use to numb the emotions. They're feeling so much that I would rather distract myself. I'd rather feel this than have to go into all these deep emotions that I don't know what's going to happen if I go into those. Um, Also, it can be a sense of wanting to control their body, because if it's like a sexual trauma or an assault, they didn't have control in that situation. And so they're trying to control their body through this mechanism.
Yeah, absolutely. And then you kind of touch on one other point within the article of it also being nonverbal communication. So can you kind of expand on that idea too?
Definitely. Yeah. I talked about in the article, one thing I always ask my clients that struggle with self harm is just, what would the cut say if they could speak? Because it is a physical way that the person is trying to communicate. And some people do that more where they cut where can be seen and others where it can't be seen. So some of that is more blatant communication than others. Um, and a lot of times with the self-harm and with the pain that they're experiencing, they don't have words for it. And this is the only way they can maybe feel like they can express that. They're feeling so much pain that they would maybe they don't experience the pain of the self-harm as much as maybe they would before it, or they rather feel that than the intensity of the emotions. Um, it could also communicate the shame and the guilt. Like, something's happened. I don't have the words for it. I don't know what to do with this. Please help me. And they don't know how to communicate that, maybe to their loved ones, or maybe that they would be accepting of that. And just unfortunately, our society has kind of viewed self-harm as a certain way, and it can be hard to talk about that, be open about that, and ask for help about it. And so that's another reason for this article, is just to give light to the importance of communication around it. And if we see someone we love, a friend struggling, it's okay to open up and talk about it.
Yeah. So cognitive distortions is one of the things that you mention in your article. Can you kind of talk a little bit about what that is?
Yeah. Yeah. So a cognitive distortion is a belief that we have that internally we believe is true. But if we would say it to other people, they would kind of be like, what are you talking about? That's definitely not true. How can you not believe that? Or how can you believe that's true when it's not? And in the article, I talked about a few cognitive distortions that are so common with people who have trauma and self-harm. And one of the very common ones is, no one could truly love me if they knew what had happened. And that is one that really runs deep. And with this one, I just acknowledge, I try to be someone that when they share these things with me, sit with them in it and know that when they share this with me, that doesn't change how I feel or see them. And I hope that if they would share that with any friends or family, that they would have that same response. Also, another cognitive distortion with like trauma, self-harm, um, are just that they are flawed, they're bad, they're incompetent, maybe their body is disgusting. And so if you think about that belief, then you can kind of understand why someone would hurt their body if they see it that way, almost like a form of punishment, which even just saying that or even walking with someone through that, it hurts you so much because you don't want them to do that. But just trying to understand where they're coming from. And then the last distortion that I talked about was that there's something wrong with them. And that's heartbreaking too, when someone who's experienced trauma, when they feel like it's something wrong with them, that this happened to them because of this, or if it's an assault, that it was their fault. And it's so hard to hear that, and helping them walk through those beliefs, and helping them come to like their body again, like themselves again.
Yeah. So say that there is someone who is tuning in today, who is watching this video, listening in. What would you say to someone who is a loved one of someone who is struggling with self-harm? What can be done? How can they come alongside and love that person well?
Yeah, I would say, first of all, initiating conversation, something like, I really see that you're struggling. And I've seen that there's some things on your body that I just wondering if you'd like to talk about, or if you're struggling with self-harm. And I'm here to talk whenever you're ready. I want to talk about it. Um, and there is a piece of it, especially if there's like minors and things like that. If you have a child under 18, the parent kind of needs to assess, hey, how serious is this? Do we need to get immediate help? That is a piece of it as well. But I also think the conversation with anyone should be, I think it would be helpful for you to talk to someone who understands, who can help you with this. I will help you do that. I think the important thing to know is, if a family member or you're someone struggling with self-harm, getting help, getting to a professional that knows how to treat this, how to work with this, is a must, just because even though it is a coping mechanism, it's not a helpful one, and there's help.
Yeah, absolutely. And then On the other side of it, what would you say as a counselor, words of encouragement, maybe advice to someone who is watching this, who's tuning in, who is struggling, who they themselves are struggling with
Yeah.
self-harm?
Yeah, I would just say you're not alone. I see you. You can be seen, you can be known, you can be accepted, you can get through this. There is help, and don't give up on the work that you want to do and getting through the trauma and getting through the self harm. Don't say, I'm going to do it tomorrow or another day, or I don't need help. Make sure that you get the help that you need and know that you don't have to go through it alone and you can still be accepted um, throughout your journey with trauma and self harm.
Yeah, absolutely. Yeah, you guys, if you are tuning in today, thank you so much for listening in to September Trent as she kind of covers this article that she's written. And as she said, we just have a desire for you to live a full life, and a life just beaming with joy. And it's so hard, and we experience so many different things, different experiences in life, traumas that can make it so difficult. But we definitely desire just that safety for you. If you're tuning in and are struggling with this, please reach out to us. There's always someone willing and ready to sit and talk with you, September included. So thank you guys for listening in with that one. And September, thank you just for your tenderness and kind of covering that with us. So with that, we're going to kind of jump into our next topic of conversation for our My Counselor Live episode. Guys, if you're just now jumping on, welcome to My Counselor Live. This is our weekly show here, and we get to just jump on. I'm Tori, and I'm sitting down with September Trent this week, and we sit down with a different counselor every week just to kind of pick their brains, get advice, talk through some of what they've written and their knowledge and expertise on things. So today we're sitting down and talking through some different things. One of them is our trending topic today, which is imposter syndrome, which I think, correct me if I'm wrong, has become maybe even more of a thing in the past maybe 10 to 15 years of social media and technology than ever before. So let's kind of just dive right in. September, what is imposter syndrome?
Yeah, it's when an individual doubts their skills, their accomplishments, despite that there's evidence otherwise. Often it's seen, and it doesn't have to always, but in like overachievers, perfectionists, they're not able to see their part in maybe their accomplishments. They see that they accomplish things through luck. And so, an example of this is like someone maybe that has graduated college or going into graduate school, they would maybe say, this wasn't my ability, it was luck, or this person helped me. But if someone maybe really knew how I felt, or I don't feel good enough to go into this job, then they would feel that, I was a fraud. And so there's kind of this like fear that develops.
Right. Would you say it's kind of rooted in like insecurity?
Yeah, I would say it is rooted in insecurity. There's been some like studies done on it. I mean, imposter syndrome isn't a diagnosable mental illness or anything like that. But when they've done some studies on it, they've seen that family of origin and society kind of can create this. And maybe parents have really focused on achievement and they've praised that, or maybe haven't been consistent in the praise or the maybe scolding that they gave the child or the person. And then also our society as a whole really values achievement and what we can gain, what we have done. And there's a lot of pressure there.
Yeah, my next question was kind of around that, was like, why does this even happen? Is this rooted in our childhoods? What is it rooted in? How does it happen? And like I said before, I feel like it is very common nowadays, especially with this, new world of technology and social media, where you really see highlight reels all the time that people are posting. And it can definitely, I feel like, weigh you down if you already were struggling with different things, with insecurities and all of these things. I mean, seeing the highlight reel of a friend and all of their accomplishments and, their perfect children or whatever it might be, I mean, it can be really disheartening.
Yes. Yeah, definitely. We get caught up in looking at, like on social media, all these pictures, the things that are shown to us, and we want to be like that person, or we want to have a life like them. And then we feel like if they really knew what my life looked like, would they accept me? Maybe they would say I'm a fraud. Um, and it's important to really think about, is that actually true? Are they just showing us the good parts of their life?
Right.
Or is this accurate, really, what I'm seeing? And so, yeah, these things can develop from kind of this perfectionistic, I have to do things right to succeed. It can also come from just maybe not having a whole lot of maybe support in your life to help you understand you're doing well, you've done well in this, you've done this. Also, it's important to think about that when this happens, some people have there can be two different responses. Some people, when they feel that they're um, this imposter syndrome, they can overachieve. I have to do better. I have to meet what they're doing. Or maybe they'll just succumb to it and be like, I don't care anymore. I'm just not going to try to live up or maybe engage in the things that I see.
Right. Yeah. No. And I think the enemy just plays such a big role in this, and
Yes,
really just putting that shame on us and making us feel like you're not good enough. You're not going to succeed, all of these things. And I think he just thrives off of people who
yes,
are struggling with, imposter syndrome and all of these things. And as you said, it's not, a mental diagnosis necessarily, but it is a struggle, and it's a struggle that definitely has to be validated, because I know plenty of people who have told me directly that that's something that they wrestle with. And I know that that can be a really, really heavy burden to carry, when you're really just trying to be someone you're not, or, telling yourself you're not who you are, so
right.
that is just really hard. And how could that be avoided, September? Like, what would you recommend to someone who maybe has a tendency to go toward that direction?
Yeah, definitely. One thing about this syndrome, how it thrives is keeping it secret, keeping it hidden. If I would tell someone about how I'm really feeling or who I really am, they wouldn't accept me, or there would be all these different fears. And so the first thing that you can do is talk to a trusted friend, someone that you know will respond well to this, or that you trust. That, hey, I'm struggling with this. This is what's going on for me. And that just first step of being seen, and hopefully they will respond with, that's okay. That's perfectly fine. Or I understand. Or a whole different of multitude of other things. So I think that would be kind of the first step, is just bringing light to it, because like you said, Satan will, use this, if we keep it in the darkness, to eat at us, and we have to bring it to the light so the Lord can shine that light on it. I also think that um, if this is becoming a real issue for you, it might be helpful to seek some professional help just around if there's a lot of anxiety, perfectionistic thinking, ruminating. Not necessarily that there could be something there, but it could be helpful to just talk about some of these insecurities and the focusing on some of these things. Like specifically, just thinking about the imposter syndrome, just cognitively, just all of the negative thinking patterns that can come as a result of that, or can be um, strengthened, of I'm not good enough, I'll never be able to do this. Oh, look at this so and so, they've done so much more than me, and just having to live up to all these unrealistic standards. Um,
Yeah.
and then and then just like the emotional side of it, just have there been emotional wounds in the past that are making this imposter syndrome show up a little bit more easily, where there wasn't nurture, there wasn't someone there that you had in your life, or just other hurts.
Right. Yeah. I mean, I even think of just triggers, are there specific things that comes out more with, and Yeah, so good, so good. And I do think that it is so common, and definitely want people watching who maybe do struggle with this to know that they're not alone, and that, it's not weak to seek help if that's something that you have a lot of anxiety around right now. In fact, it's probably way stronger to seek help and to really just tackle it head on and bring it into the light, because that is such a brave thing to do. Because we live in a world that tells us to hide that tells us to only show the highlight reel. That's just the world and the culture that we're living in right now. And just to be that person who's vulnerable, who's transparent about their struggles, is so important. So
Yeah.
yeah, love that. So good. So for kind of the last half of the episode, we get to kind of have our Q&A portion, where we get to answer questions that you, the viewers, the listeners, have sent in. This is a really special part of the episode, because this is kind of the part where we get to interact with our people, and people who have sent in questions. So we're going to jump in, but if you think of a question as September and I are talking, feel free to inbox that to us, to comment it below, or go to MyCounselor.Online/ask and submit it on the form there. So we're going to jump into our first question, which is, can someone who has gone through mental illness become a counselor?
Yeah, yeah, this is a good question.
Yeah.
So, short answer is yes. But just knowing the journey to that is going to require some things. In actuality, probably more people than you expect who go into counseling probably have had their own experience with some type of mental illness or someone in their family, and that inspired them to go into the field.
Right. I was just thinking about, like, so many counselors, I get to do this every week. I get to sit down with the different counselors, and so many that I've talked to really bring their own story and their own experience into their practice and into what they do.
Yeah, yeah, and that's something to remember is that none of us are perfect. We all have our own struggles, and the importance of it is, throughout your training to become a counselor is doing your own work. Having a therapist where you're working through some of the mental illness or other trauma or whatever's there, so that you can be a healthy person to help people. Because if you're not healthy, then you aren't as able to help your clients. And it also may require too, just, and it will, continuing therapy probably throughout your job, throughout your time practicing as a counselor, just because things will come up for you and you need to have a space to process that. So once again, that you're healthy for your clients. And that being said, just being self-aware that there are certain things that maybe it's going to be difficult, I can't work with, or this is a trigger for me. And so I need to be proactive about this.
Right. There's kind of a stigma, I feel like, hinted at in this question, where, like, counselors have to be perfect, right? That,
Yes.
like, counselors have to have it all together because they're helping people get it all together. And I think that that is really interesting. And, September, correct me if I'm wrong, do you have it all together all the time?
Definitely not. I wish I
Exactly.
did, but I don't.
Right, right, right. We're all human beings with flaws, with struggles and traumas that we're all working through. So I love this question. I love the heart behind it. And
Yeah.
definitely, I mean, some of the greatest counselors, people who can speak into such incredible, hard things, have experienced them themselves.
Yes, definitely. Yeah, and have known how to speak into that in other people. They've gone through the journey, so they know what it's like when they walk maybe someone else through that journey. And they know the encouragement, the words to say. And so, whomever wrote this question, I would say, don't give up. You can do this. Just be willing to do the emotional work that all counselors have to do. Usually in graduate work to become a counselor, you have to do your own counseling. It's encouraged, required, and so it's not an abnormal thing. Um,
I
and
did
just
not know that. That is
Yeah.
so, that's so great. That honestly is cool to hear, that, like, counselors, that's a requirement in order to be a counselor, is to have counseling.
Yes, yes. Yeah, it's so important to go through the experience, go through the process, and be vulnerable and understand what's going on for me. What do I need to work on? How could maybe things that I've experienced impact the work that I'm going to do? Or if I'm struggling with a mental illness, how can I be proactive with this? How can I incorporate my own coping skills into my daily life so that I'm the best I can be for my clients? And I think too, you were right, Tori, in just that we feel like there is this stigma around counselors that you have to be perfect. But if you really think about it, if anybody out there listening has gone to counseling, the counselors that are real are ones that you really connect with. And we don't necessarily want someone to be just perfect and have it all together. Yes, counselors need to have it together, but they don't need to be perfect. And, that's not what we want.
Yeah, I even think of, I've done it myself. I have a couple of friends who are getting married, who are engaged, and they are both counselors. And I've done it myself where I've been like, oh, you guys must have a perfect relationship, no communication issues.
Yes.
But at the end of the day, like, they're human beings too. Like, yeah. And if anything, I mean, they probably have some pretty clear insight into things that, maybe makes it even harder to communicate sometimes, because that can be sort of difficult when you're like, oh, I know exactly what I'm doing right now.
Right. Yeah, definitely. Yeah.
Awesome. Well, I appreciate this question. Thank you guys for submitting it. Super great. And we're going to move into the next question, which is sort of a broad one. I'm curious to kind of hear your thoughts, September. This person asked, how long does it take someone to get over sexual abuse or assault? Obviously, there's not really much information. I don't know if this was the person who experienced the abuse asking, or if it's maybe a loved one who is walking through it with someone. But what would your response be to that question?
Yeah, you are right, Tori, that this is a very broad question, and I don't have a specific answer for it. I think the best answer is as long as they need. It's really hard to give a time limit on it, just because it depends on the person. It depends what type of abuse, assault they experienced, how often that happened, when it started, who was the person that was the offender. There's so many different aspects of the work that is done.
Right. It's not like a one size fits all when it comes to trauma and abuse.
Right. And I think what can be best for the survivor of this and family members is being patient, knowing that it may take a while for them to work through this, because this has been this experience has blown open their entire world. They think differently now as a result of it. And if this abuse has been going on for a long time, it's going to take time to work through it.
Yeah. And would you say, like, can you ever really get past, abuse and assault? Is it always going to be something that is there?
I think you will never forget it, but the emotional intensity that you experience it, we want to bring that down. We want to bring it so you don't have flashbacks, or you don't dissociate, or certain things maybe don't elicit trigger as much. But we can't ultimately forget it. And we can't always predict what's going to be a trigger, because sometimes it can be things that we don't expect, but we can prepare for those and we can have support around those. And it might be helpful just to give a little bit of structure to, like, when you do trauma work, the first thing that you have to do is build emotional safety with your therapist. You have to trust them. And depending on that person, it could take a while. And also just, you have to have that healthy attachment with your therapist and healthy attachments outside of therapy. So those kind of first two things may take a while. And then you learn specific tools that help you when you talk about the trauma. It doesn't create dissociation. It doesn't totally make you struggle to function with life. And then you get into the trauma. So there's some steps before you actually get to trauma. And so maybe even knowing that can help you understand the length of the work.
Right. And I was going to kind of say, would you say that having a counselor, that it's going to therapy, is kind of a necessity for getting through this experience? And how can it be helpful? What tools are they going to be able to give, say, me, if I had experienced this? What tools are you going to give me?
Yeah, definitely. I would say a counselor is a necessity with trauma, sexual abuse or assault. Yes, it's a necessity. And I think specific tools that you would receive is usually with sexual abuse, assault, there's some type of maybe flashback, dissociation back to that event. And so you will get specific tools on how to be grounded in your present moment, how to be mindful in your present moment so that when that happens, you're not stuck in it. You'll also be taught skills like if you experience panic attacks, high anxiety, what are specific things you can do in that moment, different environments to help calm yourself down, as well as having words for the emotions that you're experiencing them, knowing how to communicate that with safe people. And as well as how do I go about having maybe a normal relationship if it's a sexual abuse or assault and you're married, or maybe have a boyfriend? How do I trust that person? If, obviously it wasn't them, but how do I go about trusting men, or if it, or women or things like that? How do I go about doing that?
Right. Yeah. So last question around this would just be maybe, if there's someone who's watching this, if maybe the person who asked this question is a loved one of someone who is struggling with this,
Yeah.
what practical tips, I know you mentioned being patient with them, but do you have any practical tips for just being that person for someone?
Yeah. I think it's important that that person is, if they're able to be emotionally safe. And when I say that, I mean going to that person that experienced the abuse, if that person has shared that with you, and letting them know, thank you so much for sharing that with me. I know that took a lot of vulnerability, and I want you to know that if there's ever anything that you want to talk about, I'm here for you. And I think it might be helpful for you to see a counselor. And I know that's completely your decision, but whenever you're ready to take that step, I want to help you with that. And I will support you through that.
Yeah, absolutely. And I mean, that is just such good advice. And hopefully that was able to speak to someone, whether or not you have experienced this or know of someone who has, which a lot of us do. Sadly, a lot of us know of people who have experienced this. And I think having those tools kind of in our toolbox and knowing, how to communicate effectively and lovingly towards someone who is going through this is super important. So thank you for that answer and for submitting this question. Whoever asked it, if you are someone who has experienced this, I just love the vulnerability in asking this question. And like you said, September, I mean, it's not one size fits all when it comes to trauma and abuse. And I think having that grace and patience for yourself is just so vital in the healing process. So we're going to get into our last question before we kind of close out the episode, which is, they said, hey, I am interested in EMDR therapy. I have severe tinnitus from anxiety. Is this therapy appropriate? So I want to start by, for the people who don't know what EMDR therapy is, if you could just maybe give kind of an overview of that.
Yeah, definitely. Yeah, EMDR is kind of an eye movement therapy where that is used, kind of the different movements of your eyes. The therapist kind of initiates that and has you think of certain memories or certain phrases to kind of help with trauma work. And so that's specifically kind of a very general explanation of what EMDR is. And with, this question of, I think tinnitus, maybe,
Yeah, I wasn't totally sure. Tinnitus, something.
Yeah.
Yeah.
Yeah, that it has to do with like ringing in the ear, asking about if EMDR would be helpful with that. I don't have a lot of experience with those two together, but when I was doing some research about just EMDR in the past, I came on some of the studies about this. And there's been a few studies about EMDR treating tinnitus, and there are some kind of hopeful studies with it, but there's not a lot. And so with this question, I think what would be most helpful is the person, researching, is there a therapist, an EMDR therapist that they're interested in, contacting that person and seeing if they feel comfortable with using EMDR with this condition. It doesn't seem like that you couldn't. I didn't see any negative impacts with it. But I think really having to have a consult with the therapist that you want to use with EMDR, and just ask, like, can this work? Do you feel comfortable working with this? Maybe even what would it look like to work with this?
Yeah, that was going to kind of be my next question, was just, how do you even go about doing that? Do you talk to your doctor, a therapist? Do you reach out directly to a therapist who specializes in it?
Yeah. You can go about it a few different ways. You could go through your primary care physician if you like want a referral, and if maybe your intention is to bill insurance and that's the way to go, you could do it through them and get a referral. Or you could, if you have a referral, if have a friend or someone that has an EMDR therapist that you want to use that, or even kind of looking online in your area who practices or who is certified in EMDR. And then my suggestion would be calling up that person, their agency, and just asking, hey, would this person be willing to do like a 5-minute consult? I just have some questions because I have this specific condition and what it would look like to do EMDR with me. And maybe if the counselor isn't available for that, could I send them an email, or what's a good way to ask this question? Because I just want to make sure it's a good fit. And most counselors, yes, we're busy, but we really like that. We want clients to feel comfortable with us, and you asking questions is not a bad thing. You getting having the fit with a therapist is very important.
Yeah, right. And so in your experience, your research about this kind of therapy, what types of conditions, what types of experiences for people are they using this therapy for? So maybe it's not for this, or maybe there's not a lot of studies on it with this specific condition, but what conditions typically are using this kind of therapy, just for the public's general knowledge?
Yeah, definitely. Yeah, for trauma work. I think it's been used with people who struggle with like PTSD, also people with past maybe abuse, sexual trauma, assault, could also be with maybe hurts from their immediate family, nuclear family. It's also been worked on with like anxiety and depression. So it can be worked with a lot of different issues. And it is widely used for these issues. It's known to be effective for the trauma, the PTSD, the anxiety, and the depression. And so it is a common thing that whoever sent out this question is probably not going to be too difficult to find someone either like in their area or close to their area that would be able to practice EMDR.
Right. Yeah. Awesome. Such a good answer and great advice for anyone who's curious about this kind of therapy. So, before we close out the episode, September, I just want to talk a little bit. Obviously, we've got the whole new year starting 2021 finally. I would love it if you would just maybe speak some words of encouragement, words of advice to the people listening and watching, kind of going into this new year. Maybe just as a counselor, maybe just leaving them with something to think about and be encouraged by.
Yeah. What I think would be most helpful for people going into the new year is realizing that this could be a new start. Yes, a lot of difficult things happened in 2020, but we don't have to bring those with us. They don't have to be struggles for us. And ways that we can do that is getting help, adjusting our thinking, making goals for ourselves in the new year. But if there are things that, obviously, if you've lost someone or there's something difficult that you are bringing into 2021, making a commitment that this isn't going to be a difficulty for me forever. I can get through this. There's ways to work through this, whether it's through help, reaching out, or just not isolating yourself, asking for help, and just trying to have a positive and hopeful outlook for 2021. And obviously, a part of all of this is just engaging in our relationship with the Lord, making sure we're reading the Word, we're we're praying, we're speaking to him, we're hearing from him, that's what's going to be our foundation for this new year that's coming.
Yeah, absolutely. Awesome. Well, thank you so much, September, just for setting aside some time to sit down with me and talk with us and answer some questions. You guys, if you tuned in, thought of any questions, like I said, you are welcome to submit those anytime and we will answer them in a future episode. And September is available. If you are looking for a counselor who specializes with trauma and anxiety and self-harm, even these things that she talked through in this episode, please reach out. We definitely want to set you up with her. So definitely reach out to us. And thank you guys for tuning in. And we will see you next week for another episode of My Counselor Live.